Welcome to our course on common ENT presentations that you might see when you're on call. Today we're going to be talking about tympanic membrane perforation. So when assessing a patient with possible eardrum perforation, you're going to need the following equipment: an otoscope with speculum, oral suction tips and a pope wick, and swabs for any cultures and tuning fork. Patients with eardrum perforation present possibly with a history of trauma, either blunt, penetrating, or barotrauma, either after airplane travel or diving, and they may show signs of infection. They may be suffering from hearing loss, pain, tinnitus, bleeding, and they may have a history of polytrauma as well. When assessing a patient with eardrum perforation, you want to rule out any signs of base of skull fracture first of all. This usually should be done in the A&E department, but if there's any suspicion, you'll need to assess them according to ATLS principles. You want to examine the ear and the surrounding skin, look for any signs of base of skull fracture. In other words, battle sign, panda eyes, or any CSF rhinorrhea. You want to examine the cranial nerves in turn, and you'll want to do hearing tests with the tuning fork, so do a Rene's and Weber's tests. If there's a clot in the canal obstructing the view, then you'll want to gently wash this out with normal saline. You want to check for any signs of cholesteatoma and look for any lacerations in the ear canal itself. Red flags that you'll need to look out for are signs of any base of skull fracture and any cranial nerve palsy. As we can see here, there's some examples of what tympanic membrane perforation looks like. So as you can see, there's defect in the eardrum on both of these images. If you're managing this in terms of an infection being present, be sure not to use any Sofradex or any drops containing gentamicin or other aminoglycosides, as these can cause damage to the patient's hearing. You'll want to use drops of ciprofloxacin, and you want to remove any discharge if present. So if you can see them during the day, get them to the ENT clinic and gently suction out the ears and send for cultures. You'll want to take swabs anyway though. You can also consider starting them on systemic antibiotics. You want to advise them to keep the ear dry and arrange to see them at a later date, and you want to refer them to the ENT emergency clinic. You'll need them to have an audiogram and a tympanogram on arrival. If this is a dry perforation, either through trauma, you want to follow them in clinic routinely, but if it's a wet perforation, likely as a sign of infection, then you want to follow them up in the acute clinic in 7 to 10 days' time. You'll need to discuss with the registrar if the patient's systemically unwell, they've got signs of any cranial nerve palsy, or if there's any base of skull fracture, because then we may need to discuss them with a major trauma center. Thank you. That concludes our talk on tympanic membrane perforation.